Right. Hi, everyone. Thanks for joining today's PO monthly call. We will go ahead and get started. So today we just have some brief reminders and updates to go through with you all. So we'll talk about the census survey, extra credit for early learning community completion, the performance report updates, some updates we're making to the patient data dashboard, reviewing those last specialist requirements, talking about our upcoming learning community events, our CGM coverage loss survey that we just distributed, and a reminder about the final regional meeting taking place on Thursday. So wanted to remind everybody about the census survey that's been distributed. So this is a requirement for all primary care practices. We're asking that everyone complete this by December 1st. It's a relatively brief survey. It's about 15 questions, and it asks about things like staffing at the practice, the insurance mix, the EMR that's used, the quality improvement resources. This is going to be helpful for us, like in, understanding the demographics of the collaborative better so that we can report that out for research or work that we're doing with the Michigan Value Collaborative, and to just have consistent and up-to-date information across the collaborative. So for example, I think we asked practices about their EMR in 2021 when some practices first joined. I know a lot of those have changed. So I want to make sure that all the information that we have is current. We'll also be sending reminders from the admin portal to the clinical champions on November 14th and 24th for any practice who hasn't yet completed it. And like, as you can see on here, there's 151 practices that have still yet to complete this yet. So just also make sure that you're reminding them and checking in on this as we get closer to the due date. And hopefully with those reminders that we sent out, they'll be helpful to people as well. And just on our next review, reminder, wanted to let everyone know again about the extra credit opportunity that we're offering. So if both the physician level and the practice level learning community VBR requirements are all complete by January 1st of 2026, the practice can earn an additional 5 extra credit points on the VBR scorecard. So let's say, for example, someone forgets to do that census survey that we just talked about, that's worth 5 points. So by completing these early by the 1st, they would earn those 5 points back and still be able to get a full 100% score on the VBR. So it'll be helpful for practices in making up some of those points. The last caveat with that is, it can only increase a practice to score up to 100 points. Any practice that goes over 100 because they did this and or everything else, they're not going to earn additional value-based reimbursement, but this does help to make up for things that may have been missed. So later this month, we're going to be distributing updated performance measure reporting for the PCP UACR measure, the PCP A1C measure, the endocrinology CGM interpretation code billing measure, and the nephro UACR measure. So right now, what you have available to you is the baseline reports. These are available in the admin portal for the PCP measures and will be available on the admin portal shortly for the specialist measures at all. So you'll be able to see all of those baseline rates. And then once these are available, we're going to post these in the admin portal as well. And we'll send you an email to know when these come out. Any practice that has admin portal access will be able to view their own reports so that it's not on you to send these out. That said, your practices who don't have admin portal access, please make sure that they're receiving this updated reporting, or encourage them to get admin portal access so they can view it themselves on there as well, so that you're not responsible for distributing these. And this is just a preview of what the reporting is going to look like for these updated reports. So here's the one for A1C that's looking into similar to last year, the Medicare, the commercial rates, the percentage of patients who have had one recorded. We're going to be adding quartiles as well so that you can see how the practice is performing compared to others. We'll have information here on if the goal rate's being met or not, and we're going to link out to things like the patient data dashboard and to the measures detail document so that there's information on there where they can get additional details on their measures. Here's an example of the PCP UACR measure. So you'll see a lot of those same things. Are they meeting the goal, where their baseline rate was, and where their goal rate is, the number of attributed patients, and performance over time. For this first one, you'll of course only see progress report 1. And then in these later progress reports, you'll be able to see this number go up over time. And did want to give everyone an update that we're still waiting on information on the target rates for A1C. Blue Cross Blue Shield let us know that these would be available in November. We checked in with them earlier last week. They haven't received the HEDIS benchmarks for commercial yet, and they're working on the estimated target for the Medicare side of the measure. So we will share these updates as soon as they're available, and we'll continue to follow up with Blue Cross Blue Shield and hopefully have these before the end of the month. And then wanted to let everyone know about the patient data dashboard updates. So we are adding visualizations for each of the performance measures. So if you recall, last year we had the A1C performance measure on the dashboard where you could see how your practices are performing. And because the dashboard updates a little bit more frequently than the push reporting that we do for the collaborative, at times of the year, you'll be able to see more up-to-date data on the dashboard. We estimate that this will be released on the 30th, so right at the end of the month. The data will be through August 31st for Blue Cross Blue Shield, and the data will be through June 30th for the Medicaid claims data. You'll be able to toggle between like the performance population and the overall population. So these are the ones that we're adding related to the UACR. So this is at the PO level here, and much like we had for the A1C, you'll be able to do a drop down and look at each individual practice's baseline and goal rates and see how they're performing, see a list of patients who haven't gotten these done yet. So all that information will be on the dashboard once we do this update. Here's just an example of what the endocrinology one will look like. So it'll be similar to the information that we're giving on the reporting and just provide that detail at a higher level. And here's an example of what we talked about with being able to drop down link to the specific practice population. So we've removed the practices names here, but you'll be able to see where they started for each practice, what their goal is for each practice, and where they are now. And just to remind everyone, because it's so early in the performance year, and because each of these process measures start from zero, since it's an annual thing that's being measured each year, it would be expected to see these kind of lower rates because it's really just based on 2 months of data, July and August, when we started the performance measure. And, you know, as we go throughout the year and more patients get screened, we expect that to increase. And then here's where you can look at, again, we removed this since it's patient data, like who's gotten screened, who hasn't, and be able to see those kind of details on there. I wanted to remind everyone that the final regional meeting is taking place tomorrow from 6 p.m. to 8 p.m. So if your PCP clinical champions didn't attend the first meeting, please follow up with them to make sure that they attend the one tomorrow or that a substitute attends from their practice, since this is the final one that we're offering. Attendance is up to date in the admin portal, so you can see if your practices and weren't able to attend the October meeting and follow up with them to let them know about this other opportunity. And then just as a reminder, it's PCPs only that are expected to attend this. The specialists have had their clinical champion meetings already this year, and so they don't need to attend this as well. And yesterday we distributed a half-page flyer for practices to share with patients so that patients can share their stories about how having a CGM has impacted their care. Pictured on this slide is what the flyer looks like. So it has both a QR code and a link where practices can or patients can sign on and take this survey. It asks questions about, you know, how a CGM has impacted a patient care, what a patient would be willing to pay out of pocket for a CGM, and some other questions along those lines that we want to share with payers to demonstrate the value of CGMs to patients and make sure that patients have a voice on this. We're going to have the survey open through December 12th. So please encourage your practices to distribute this to patients. We've had, you know, a lot of practices reach out to us with these coverage changes and like these tighter restrictions on prescribing CGMs, wanting to know what they can do and how they can make their voices heard. And this is a way that will be meaningful and impactful to payers to hear this like patient perspective. So if your practices do want to do something about this, this is a great route, is to support us in getting these patient voices heard. So please encourage them to do that and to follow up with them on the flyer that we sent out yesterday. And then just as a check-in for the specialist meeting, so as I've mentioned a little bit earlier, both specialist clinical champion meetings have taken place. The nephrology one was on October 7th, and the endocrinology one was last week on November 6th, and attendance has been tracked within the portal. We'll be following up with specialists who missed the sessions to give them an opportunity to make up the attendance for those, since that's a requirement for the value-based reimbursement for specialists. And slides from these meetings have been shared with the participants and with the PO, admin leads, and primary contacts. So you should have this information if you want to refer back to it. And finally, we want to talk about the last requirement for specialists for this year. So we've asked each specialist clinical champion or someone from the practice to log on to the patient data dashboard at least once during for this performance year, and for endocrinologists to sign an attestation that they've read our document on how patients are being attributed to endocrinologists. The reason that we're having endocrinologists read this document and attest to it is because we as MCD2D, in partnership with some of our participating endocrinologists, developed our own attribution algorithm. So we wanted to make sure that everyone understands how patients are being attributed to them. Whereas for nephrology, we use the same attribution model that Blue Cross Blue Shield uses for some of their nephrology programs. So we didn't build out a custom one that we want to get that input on. So we do have the link to the attestation form on this slide. We also sent out an email reminder to all of the endocrinologists this morning about this requirement. As of this morning, none of them have signed it yet. So please remind them and make sure that this gets completed. As far as for the login requirements, we've had a number of nephrologists log in and some of the endocrinologists as well. But until they sign the attestation, it won't show as completed for the endocrinologists. So we'll continue to support and follow up with this throughout the remainder of the year as well. But please, when you speak to your specialist, remind them about this. And then we have our final learning community event of the year taking place this Friday at noon. It's going to be on pregnancy and type 2 diabetes with our endocrinologist, Dr. Jennifer Wyckoff, presenting on this. Practices trying to earn those 5 extra credit points. This will be an easy way for them to do it and to get CME as well. So please encourage your practices to register and attend. And learning community events, just as a reminder, they count for the physician level learning community credit, not the practice level. So the only time that credit is dispersed for this is when the attendee is a physician. If someone else from the practice attends, they're able to get CME for it, but there's not learning community credit for that. And we are also working on next year's learning community event series. We'll do the poll at the next regional meeting tomorrow to understand the topics that people want to have covered and what we should focus on for the 2026 learning community event series. And then we'll start to define what that looks like, and hopefully for our December meeting, have an update for you on at least some of the topics and speakers that we'll be covering, and we'll plan to share that with the collaborative as well. And then just as a reminder, for December, the PO monthly calls are going to be taking place on December 15th at 11 a.m. and Wednesday, December 17th at 2 p.m. We did push these back a week from when they're normally hosted during the second week of the month due to a conference that we're attending. So just wanted to make everyone aware of that. It should be updated on your calendars as well, so you should see it there. All right, any questions before we hand it off to Inhale? All right, well, thanks everybody for joining. You should see, one question in the chat. Can you remind me about the CGM and BCBS availability for next year? Is it no longer available to those with Blue Cross commercial by virtue of having type 2 diabetes, and will people be getting grandfathered in? So to answer your question, yes, Blue Cross Blue Shield is removing the exemption for MCT2D and PDCM providers, whereas previously with just a diagnosis of type 2 diabetes, patients were able to get a CGM. They're reverting that to their criteria around having to have like insulin use or hypoglycemia and other complications with diabetes in order to receive a CGM. So we sent out a communication about that, and it's going to be on the slides for the regional meetings as well. As far as people getting grandfathered in, people aren't grandfathered in, but the prior authorization is valid for a year. So for example, if you prescribe someone a CGM tomorrow who only has type 2 diabetes, they'd still be able to get a CGM until, 11/13/2026, but it's not going to be grandfathered in the sense that providers and MCT2D who are already part of it are going to continue to have that exemption. So it would just be until the prior authorizations expire. And this does also unfortunately apply to the patient empowerment toolkit as well, where that's not going to be able to be prescribed in 2026 either. And then another question is logging into the dashboard complete the practice level requirement. Yes, it does. And we update that on a monthly basis. So if you haven't checked it recently, Mary, check now. I know our admin uploaded that, I think last week to update with anyone who's logged into the dashboard twice since the start of the VBR year. So you may see it complete, and if you don't, send us an email and we'll troubleshoot that. Any other questions?